What's going on, and welcome to another You Ask, We Tell, where we recently have been answering the most commonly heard questions relating to EMR Archival. I'm Steve, and thank you for being here. So staying on that EMR Archival theme, the topic, the question of the week is, are there benefits to using an EMR Archival System versus continuing to run a legacy EMR? So let's dive into the actual answer. When switching or migrating EMRs, there are essentially three choices or options to ensure that you have all of your historical patient medical information available. Number one is simply migrate all of the data and associated documents in the legacy EMR to the new one. And you have to migrate 100% of the data. Two, operate and maintain two EMRs, the new system and the legacy system. And number three is adopt an EMR archival solution. So let's look at the pros and cons of each choice. So for migrating all of the data, the pros are it's cost effective if the vendor has a proven script to follow, and it's only efficient if they have a proven script. Otherwise, it can be very difficult to get all of that data over. Another positive or pro is you're only going to have to use one EMR going forward because all of the data has been migrating, assuming it is successful. Now, but of course, with anything, any option, there are cons. And a couple of the cons, it can be very, very difficult to migrate all of the data. And there is possible inaccurate data migration in some instances, but there is risk associated with any one of these. Number two is operate and maintain two EMRs. The pros is the simplest to deploy because it's already running. Your legacy EMR is already running. All you need to do is go live with your new EMR. There's no additional training that is associated because the legacy EMR has already been in use. The only thing you need to get used to is the newer EMR. Moving on to a couple of different cons. There's a continued license fee. There is technology maintenance, continued updates, and if you don't run the updates, if you don't run the maintenance fees, there are security risks, so you have to keep up with them, which is obviously a cost. And also there are cloud-based costs will still need to be paid in order for you to be able to access the legacy EMR, and the users will need to be able to log into two separate systems to access legacy patient charts. So those are a couple of the cons, and as far as accessing two different EMRs, it can just be more busy work, having to log into each one, so it can be more of an inconvenience than anything at times. But there is a cost associated with running two EMRs. Moving on to number three, the final option is adopting an EMR archival. The pros here are that they do meet all legal requirements. There is a continuity of care because it integrates with new EMR, and it is easy to use. So you can easily produce charts or medical records, and there's a quicker go-live time with your new EMR. So the thing with an EMR archival is it's a quick process. So as long as a vendor or a company has a quick way of extracting all the data and putting it into their EMR archival, you will have a quicker go-live date with your new EMR because it's just a very simple process. Also, there are a couple cons though. Like we said, it's a little bit of a trend. There's pros and there's cons. A couple of the cons, there is a cost associated. Whether it's a monthly or a one-time fee, there is a cost associated with an EMR archival solution and getting one. Also, there's a quality and validation process that has to strictly be followed to ensure that all data has been migrated properly. So whether you're going with migrating all of your data, operating and maintaining two EMRs, or even adopting an EMR archival, there are pros and there are cons. There is a risk associated with each of them. So the question that we started with, is there benefits to using an EMR archival system versus continuing to run a legacy EMR? So there is a benefit. There's absolutely benefits to both, and each one has their pros and each one has their cons. It really depends the route that you want to take and the one that you want to go forward using. So that is all for this week's You Ask, We Tell, where we are answering healthcare IT's most pressing questions. And as always, if you're enjoying these videos, please like them and give us a comment below. Let us know how we're doing. We really want to know, get some feedback, so what we can do in future videos. Reach out at the number below or at our Instagram, Twitter, Facebook, any of our social media outlets. We'd be happy to answer any of your questions. So that is it for this week, and we look forward to seeing you next week.